The final topic will be major minerals and bone health and iron. We'll look at deficiencies, toxicities, functions, and food sources of the bone minerals calcium and phosphorus. We'll talk about osteoporosis and the risk factors, and we'll also look at iron. We have calcium in our bones, and we also have calcium in our body fluids. Most of the calcium in our body, 99%, is found in the bones. That remaining 1% is found in our blood, but that 1% has many essential functions. The bone and blood calcium are kept in a balance with a system of hormones and vitamin D, but the blood calcium will remain in balance at the expense of bone calcium and the risk of developing osteoporosis in later years. In other words, that 1% of calcium that's found in our blood is so important, the bone will sacrifice its calcium in order to maintain blood calcium levels. And some of these important functions include muscle contraction, heartbeat, nerve impulse transmission, blood clotting. Calcium is involved in all of these reactions that go on in our body, and in the absence of calcium, we could die. Therefore, the calcium in our bones will be sacrificed in order to maintain blood calcium levels. With adequate calcium intake, blood calcium will remain normal, and our bones will deposit calcium, which will lead to the development of strong, dense bones. In other words, a good diet with adequate nutrient intake will give us normal levels of blood calcium and strong, healthy bones. But with a poor diet, you should notice that the blood levels, these little red dots represent calcium, still remain the same at the expense of the bone giving up its calcium, resulting in weak osteoporotic bones. Again, that 1% of blood calcium is so important that the bones will be sacrificed. Bone calcium will be sacrificed in order to maintain that 1% blood calcium. Dairy products are a good source of calcium, but we can also get calcium from non-dairy sources like fortified beverages, cereals, canned fish with the bones. Okay, so here I'm talking about canned salmon, and yes, I'm talking about the bones that are found in canned salmon. That's where the calcium comes from. So if you have canned salmon and make salmon salad, you're supposed to keep the bones if you're looking at it for a good source of calcium. Also spinach, turnip greens, tofu, you guys can read that. Of dairy sources of calcium, this is cocktail chatter. And here's the calcium in non-dairy foods. A lot of people take calcium supplements because they don't get adequate dietary calcium. First of all, I want to tell you that, of course, I recommend food sources of calcium because it's more available to the body for use. When you drink milk, you not only get calcium, but you get lactose, you get vitamin D and magnesium in order to help absorb the calcium more effectively. Whereas when you're taking a calcium supplement, all you're getting is calcium. That being said, if you aren't going to get adequate dietary calcium, then maybe a calcium supplement is something that you should take in your diet. Because over time, in the absence of dietary calcium, in the absence of strengthening of bones and other nutrients that are important for bone health, you can develop osteoporosis, the silent bone stalker. The table lists two types of osteoporosis: postmenopausal, and what I'm calling elderly, because the book referred to type 2 osteoporosis as senile, and I hated that. So I changed it to elderly. The onset for type 1 osteoporosis between 50 and 70 years, type 2 over 70. The bone loss, where the bone loss comes from, is different between type 1 and type 2, and that's what we're going to look at. Men are at a much lower risk of developing type 1 osteoporosis, but they can develop type 1 osteoporosis. The fracture site is different between type 1 and type 2, and the causes are somewhat different. In women, type 1 osteoporosis is associated with estrogen loss. As men age, testosterone levels decrease, and they also have an increased risk for osteoporosis. In type 2 osteoporosis, there's a reduced absorption, there's increased loss or demineralization of calcium from the bone, but also depending on the person's situation, if they are ill, if they're bedbound, if they're on a lot of medications, there may be an increased risk for falling. This is a picture of the hip bone, the trabecular bone, and the cortical bone, the bone on the outside, that hard outer shell. The trabecular bone is the lacy inner structure in which calcium crystals are deposited that support the bone structure and provide a calcium storage bank, which we'll talk about in a few minutes. The cortical bone is that dense bone tissue that forms the outer shell surrounding the trabecular bone and comprises the shaft of a long bone. So it's this outer strong portion of the bone. Bones are made of two types of cells. Well, they're probably made of more, but for our purposes, osteoblasts and osteoclasts are the cells that make bones. Osteo is a prefix for bone. Osteoblasts are the bone-forming cells. They're the ones that deposit minerals and proteins in the bone for maintenance, growth, and repair. I remember osteoblasts as builders because they both contain B. So if that helps you, use it. If it doesn't, forget I ever said it. Osteoclasts are the ones that break down old bone to make way for new bone and help maintain blood calcium levels. In other words, if your blood calcium levels start to drop, the osteoclastic activity will increase in order to break down bone and release calcium to maintain blood calcium levels. Bone mass is gained during the first 25 to 30 years of life. This would be a period when osteoblastic activity outpaces osteoclastic activity. We then have a period of maintenance or stabilization for around 15 years until about age 40. The exact age depends on the individual, when osteoblastic activity is pretty much equal to osteoclastic activity. Then after a woman goes through menopause, there's a decrease in production of vitamin D, a decrease in absorption and metabolism of calcium and vitamin D. There is a decrease in estrogen production after menopause, and the woman begins to lose bone calcium. We see two different graphs on the right, one in which the woman is not losing bone density or as much bone density and is able to maintain much of her height. In the lower picture, the woman is losing much more density in her bone. She's starting to develop a curvature of the spine because the amount of calcium is being lost, a compression of the vertebrae in her spine, increasing the risk of fracture. At the bottom, on the right, we see what porous bone looks like. That's where osteoporosis comes from, porous bone cells. On the left are healthy bone cells. This is to remind me to give you my bone bank, my calcium bank analogy. So think of your bones as a calcium bank. During the first 25 to 30 years of your life, you can deposit into that bone bank. And then, depending on whether you have a lot of calcium in your deposit, in your savings account, well, yeah, let's talk about this as like an interest-bearing savings account. And depending on how much you put into your savings account as you age, when you go through menopause or when men stop producing as much testosterone and start drawing on their calcium bank, depending on how much you had in it when you reach that stage in your life, if you're drawing on the interest, let's go back and look at our woman in the previous slide. You'll be the woman on the right, but if you are drawing on the principal, you will be drawing on bone density, you will be losing bone, and you are at much greater risk for osteoporosis. So that's why you should think of your bones as a calcium bank. You may not be able to notice any benefit of your account right now, but when you reach a stage in your life when you need to start drawing on that account, you want to be drawing on the interest and maintaining your height and bone density, not drawing on the principal and losing height and bone density.